So now I'm going to ask Dario if we could do these polling questions. So I have 2 quick polling questions for everyone. So the first polling question is, when you are doing a scoping review, should you plan to conduct a meta-analysis? Great, so we have the majority voted here, 64%. Our answer is not going to change. So we see 91% of you all said no. So this is a great point. So you see in the Joanna-Briggs Institute, we don't discuss meta-analysis. And the reason is because the purpose of a scoping review is actually not to come up with a point estimate and confidence interval. It's actually to chart or characterize the literature and what's been done and identify data gaps. So when we're planning a scoping review, in general, we don't plan to conduct a meta-analysis. But now what we can do is we can start with a scoping review, and then we can move on to a more focused systematic review subsequently, where we would likely have to update our literature search, and then we would plan to do that meta-analysis when we're doing our systematic review. So well done to all of you for answering that correctly. So now we will move on to polling question 2. And I will ask Dario to open this again. So when you're doing a scoping review, should you plan to appraise the risk of bias of the included sources of evidence? Great, so we have about 70% here who voted, so thank you, Dario, for closing that. So we see here that 75% said no, and about 25% said yes. So this is actually something that's very, very interesting, and one of the hardest items for our PRISMA extension to scoping reviews. And it comes back again to your research question. In general, we don't plan to appraise the risk of bias, because we're more interested in charting the literature and find out what has been done versus what the quality of it is. However, that doesn't mean you can never appraise the risk of bias in a scoping review, but you would have to provide a rationale as to why you needed to do this. Perhaps your knowledge user felt that this was something that they really needed to move the field forward. But usually what we would do is we would start off with our broad scoping review, chart and characterize the literature. Then we would come up with a research question to do a more focused systematic review. And then in that systematic review, we would appraise the risk of bias, and we would potentially conduct a meta-analysis. So that's usually how we start when we're thinking about these different research questions, and how we would go from a broad scoping review to a more focused systematic review. So in summary, scoping reviews are conducted to map the literature, and they're really useful when the research is emerging or it's a novel topic, or if it's heterogeneous and complex. And we can use the Joanna-Briggs Institute guidance for doing our scoping reviews. So I hope today these learning objectives were met. So this is just a quick recap of what we set out to do. And I think we can take a few questions now, but I just wanted to acknowledge the funding that we've received from CIHR, as well as the Canadian Agency for Drugs and Technologies in Health, as well as my Canada Research Chair in Knowledge Synthesis. I want to give a shout out to Aaron Lilly and Wasifa Zaran, who've been really helping me push forward and advance the methods of scoping reviews, and they're fantastic research coordinators with my team, as well as my boss and mentor, Dr. Sharon Strauss, and wanted to thank everyone for their attention today, as well as provide a few references. So now I believe we can open this up for some questions.
Thank you, Andrea. This was a really interesting presentation. Thank you, Kafayat, for adding about your experience. And Andrea, especially thank you for talking about extra, for examples outside the health sector. That's definitely the focus of GESI. So we're going to take questions. So first, there was a question about the difference between systematic reviews and scoping reviews. Do you think you could add anything else other than what you already talked about?
Nope, I think that I'm hoping that it's clear now, but if anyone has follow-up questions, please do not hesitate to ask.
Okay, so what kind of evidence do you usually include? Do you include only primary studies, and what about book reviews and editorials?
That's a fantastic question, and I think it really depends on your research question. So if your research question is amenable to opinion pieces and book chapters, then absolutely yes, include those sources of evidence. But perhaps your research question is not amenable, and those types of sources of evidence wouldn't actually be helpful, so then you wouldn't include it. So it really comes down to what your focus is and what your research question is.
Okay. Great. So the next question is, please could you elaborate more on how to formulate scoping review questions?
So that's another great question. So in the Joanna Briggs Methods Guide, they do talk about the PCC, which stands for the population, the population context and comparator, I believe. So they go into a bit more detail about how to do that. Again, it depends on what kind of a scoping review that you're looking at. So are you really looking at an intervention or a program? If you are, then you could use the PICO as well. Again, scoping review questions are a lot broader, right? And you have to make sure that they're actually searchable. So that's why it's often useful to work with a librarian to see kind of how you can scope the question and how you can make sure that it's searchable. So there's different ways that you can do it, and again, it depends on the type of scoping review that you're planning.
Great. So the next one is, what is the difference between scoping review and evidence mapping?
Okay, again, amazing question. So we have an amazing group here today. Very impressed with these questions. So I think that the objective of the scoping review and evidence mapping are likely very similar. However, with the evidence mapping, they would take the results to the next level where they would produce these beautiful maps that would be charting the information that you have. So I think that the evidence mapping would take it a step further. However, the objectives would likely be very similar.
Great. So the next one is, in your experience with submitting scoping reviews for publication, have you experienced any pushback from reviewers asking for a risk of bias assessment, and how would you address this?
Another brilliant question. So I have not experienced this myself, but my colleagues have. I have to admit that when we submit a scoping review for publication, we are very proactive, and we actually state right in our methods that we did not appraise methodological quality because our research question wasn't focused on that. And that was actually consistent with the Joanna Briggs Institute guidance, as well as with our 494 scoping reviews. Very, very few of them appraised risk of bias. I think it was around 10% that of the 494 that actually did that, but I would have to pull up the paper to make sure that that's the correct number that I'm giving you. So I would be proactive, and in your methods section, I would state, we didn't appraise it, and this is consistent with the Joanna Briggs Institute, as well as, scoping review of the scoping reviews in the literature.
Great. So the next question, similar to the ones before, what is the difference between a scoping review and a synthesis?
So I think that in a scoping review is a knowledge synthesis. So you are synthesizing information, but your focus is more on mapping or charting the available data versus coming up with a point estimate and confidence interval.
Okay. So the next one is, what is gray literature? Does this refer only to unpublished research, or can it include news, blogs, websites, government, private standard operating procedures, stakeholder interviews?
Excellent question. So similar to in a systematic review, gray literature, the definition is difficult to locate or unpublished sources of evidence. So it can absolutely include news, media hits, blogs, websites. It could include governmental reports. When we start getting into interviews, that's where it gets a little bit tricky. So if we do our review and then we interview stakeholders and then we come up with a synthesis that combines the evidence from the literature and the stakeholders, now we're kind of crossing over into a primary study. And that's according to our CIHR, if we were to submit a knowledge synthesis grant, including interviews, we might get into trouble because they're saying we're now crossing into a primary study. So oftentimes, if it is stakeholder interviews that have been done, and they were posted on a website or done with the government, then absolutely you can include that as a source of evidence if you are looking at a question that is amenable to those interviews. However, if your goal is to do the review and then do interviews and publish a conceptual framework, usually those are viewed by separate entities, especially when you're applying for funding.
Okay, great. So what are your thoughts on the hybridization of scoping review methodology with other review types? What is your opinion on rapid scoping reviews?
Another brilliant question. So I think you can do any type of knowledge synthesis rapidly, right? So you can tailor your methods. When we're doing a rapid review, we're tailoring our methods usually to our knowledge users' need, right? Whether that's our governmental official or clinicians, healthcare managers, health system managers, etc. So we could actually do a scoping review rapidly, and I showed an example today where we did a rapid scoping review. You could do a systematic review rapidly. You could do a realist review rapidly. So I think we could do many of these types of knowledge synthesis rapidly, and you would just be tailoring the methods according to your knowledge users' needs. Now, working with colleague Dr. Sandy Oliver and her colleagues at the Epicenter, they believe that some of the more qualitative evidence synthesis cannot be done rapidly. So we are putting forth a guide on rapid reviews, which was commissioned by the Alliance WHO, and will be launched, I believe the date is September 14th at the Global Evidence Summit. So in our rapid review handbook or guide, we do talk a bit about this and about how some types of knowledge synthesis might be more amenable to be conducted rapidly versus others.
Very good. Thank you. So a couple more questions. We don't have time to cover all the others. We're just going to pass some. So is there any standard charting form, or it depends on the scoping question, which is also related to another question that is very similar, which is how does charting form in scoping reviews differ from extraction sheet and systematic reviews?
Yep, so that's a great question. So I haven't seen a standardized charting form, and again, it would be depending on what items are most relevant to your question, and how from my experience, our data abstraction forms for charting and a scoping review versus a systematic review is that for systematic review, we create statistics files, and we're abstracting the outcomes and the results, so the point estimates and confidence intervals from all of the included studies, for example, or the raw data from the included studies, so that we can calculate those point estimates and confidence intervals. So whereas in a scoping review, it would be more high-level information that we're gathering. So we're gathering information about what outcomes have been examined. So the question is a bit different. So what outcomes have been examined in a scoping review versus a systematic review saying what are the results of those outcomes and does this program work?
Okay, great. So we have a question about how to access the Joanna Briggs Institute manual, but I think that's already published online, correct?
Yes, yeah. So there is an online resource as well as a paper that my colleagues have published. So those are found in the references, and if you can't find it, then I'm happy to share that.
Perfect. And one last question, how rapid is a rapid scoping review?
It depends on your knowledge user, right? Sometimes they want it done in 5 weeks. Sometimes they have a decision that needs to be made in 3 months. And sometimes, in terms of their decision making with a scoping review, perhaps they need to know whether a targeted, more focused systematic review has to be done. It all depends on your knowledge user and what their needs are and what they're going to be using the results for. So we've had requests ranging from 5 weeks all the way to 3 months, all the way to a full year.